So after you have your thyroid gland removed, there are some changes. First of all, the thyroid gland produces that hormone that regulates our metabolism and our basal rate, and we have to titrate that with a medication that replaces it in order to get that perfect level that you were at before. And that's very achievable, although it can take a few months to find that right level for you personally. Once we achieve that, then typically the patient won't adjust their medication except maybe once or twice in the future. In recovery from the thyroidectomy, the surgery performed for a thyroid nodule or thyroid cancer, there is about a 1 to 2 week recovery. Some people may experience some temporary hoarseness, and there certainly will be a small scar that we try to minimize and hide in a very cosmetic location. In general, people return to work fairly quickly, and with the exception of a few follow-up visits, can return to their regular activities.